ಚೆನ್ನಾಗೈತೆ ನೋಡ್ರಿ ಅದ.
I'm muting all participants.
Yes, I'm audible, right?
Yes.
Okay, all right.
I think we can start.
Sure.
7:05 now.
Yeah, we'll start, I think. All right. So if I am okay, let me just see how participants do we have right now.
20.
All right, I'll start. Fine. So a very good evening, everyone. And I think we are all a little fresh, little relaxed after finishing off the basic course in research methodology exam. Like somebody just said, we were all feeling like students. So the feeling of being a student is going to continue over next couple of more months, probably years. And isn't that what we are all hoping for? That we all always remain lifelong learner. So now we can all proudly tell our students also, that we are not just talking, we also gave exams along with you. Okay, so moving on to today's topic. Last time we just had a discussion about what is competency-based medical education, what are the various attributes of competency, what is competent. So today we go on to some more activities, some more things about the booklet. So at end of this session, the participants will be able to, we are just giving a very brief, recall and familiarize the terms used in the CBME module related to learning objectives, explain the relationship between goals, roles, competency, and objective. If you ask me personally, I feel this actually forms the crux of our entire book. If we understand the relationship, at least 25% of our work is done. Differentiate the terms competency and objective. Once we understand the differentiation, we'll move on to actually writing down the SLOs, the guidelines would be discussed, and then finally, we'll touch upon how do we align a learning objective to a teaching learning method. So now I move on. Let's recall and reflect. I always believe learning happens when we know what's our baseline status. So this is the Indian medical graduate with MCI or the new National Medical Commission is just thinking about what are they thinking of? What is it that I am actually planning to see at the end of 5.5 years? We are all moving ahead with a goal to create an Indian medical graduate who possesses requisite knowledge, skill, attitudes. These are the three things we are very familiar with. We also need to have certain values and of course, the most important, the responsiveness. To do what? So that this IMG may function appropriately and effectively as a physician of first contact of the community. I stop here because this is what I would like you to just think about for a few seconds. Remember, you and I are surgical specialists. We are talking to clinicians. All of us have done our post-graduations and we are specialists in a particular branch. Every time I want to teach an undergraduate, I need to remember I am teaching to a person who needs to be a physician of first contact to the community. I'm not teaching my MD, MS student. So every time I want to design a SLO, every time I want to design an assessment, whatever I would like to do, I must remember that I'm talking about a first contact person. And of course, how can India lag behind? Because the definition, our goal doesn't stop here. Our goal says, besides being a physician of first contact, he needs to be globally relevant. What does that mean? What does that mean to us as a teacher? So when I give a particular knowledge or help a student develop a skill, my objectives should be such that in case my student would like to practice abroad, he would like to give a USMLE, he would like to give an exam like PLAB, he is finding himself competent to do so. So we not only prepare a physician who is a first contact person in the community, but we also ensure that our objectives remain globally relevant, that our Indian medical graduate is able to compete at par with a global doctor. Too many words, but still very simple. The only thing which I always like to remember is the first contact of community, and of course, global relevance comes along with it. Anybody wants to put up in the chat whose images are these? I will open my chat also simultaneously. Anybody? Any guesses? Any guesses? Not guesses. It's a okay. These two. These two. Anyone on the chat? Who are the images I'm showing? The first two, Hollywood. Yes, I see a response. Amir Khan, fine. The lady down, always in news. Yes, I see one more response. Kangna, fine, fine. The guys, anybody wants to talk about the guys, the classic people? I see we are all more of Indian movie buffs rather than Hollywood buffs. Why do you think I have put these pictures here? Jayalalitha, fine, fine. That's Kangana Ranaut acting to be Jayalalitha. Sylvester Stallone, okay, no. No. Godfather, if I'm not wrong, one of this character played Godfather, if I'm not wrong, okay? Because I am also more of a Indian movie buff. Okay. Can anybody tell me what's common in these? Forget the guys. What's common in these two characters, Amir Khan and Kangana Ranaut? I'm not talking of their political affiliations. I'm not talking of the controversy. I'm talking of something else. I'll give one more keyword, acting style. Anybody would like to, and how does that link to my session today? What are they doing? The picture is a little explanatory of, yes, I have more responses. They put great efforts in their roles. Yes, Dr. Ajit, very true. Method acting, perfect. Perfect. It looks like you've seen my presentation. So, if I just go and I Google the word method acting, modify themselves accordingly, very true, Dr. Nitika, very true. You know what? I just, every time I come across this thing of Indian medical graduate, Marlon Brando, very true. Very true. One of the images here is of Marlon Brando, and the other one is Robert De Niro. Sorry for the spelling mistake here. And Amir Khan and Kangana Ranaut. So you know what? Every time I think of this Indian medical graduate, the terms goals, roles, competency, I don't know why, but these were some of the people who kept coming into my mind. This is a style of acting which is called as a method acting. So what's a method actor? Well, they're consumed by their roles. They meticulously research their characters to gain insight into what it feels to be them, why they make the decisions they do throughout the course of the play, a series, film, concern, whatever. So my question is, when an actor who is going to do a particular role, probably for a couple of plays, 3 hours movie, maybe a series, when they take so much preparation to get into under the skin of the role they are playing, what about my Indian medical graduate? What about me, the doctor, we, the doctors? We are going to play this role throughout our life. Of course, there will be lots of people who will say, well, the student today can learn the way we have learned, our generation have learned. But please remember, times are different. We cannot expect the student always to learn and make the same mistakes which we did. What I'm trying to emphasize upon is, when I think of a clinician, a role of being a clinician, a role of being a leader or a team member, a role of being a communicator, so important, a professional, a thorough professional, that's what we are. A lifelong learner, once again, we have proved. That's exactly what my Indian medical graduate needs to do. So if I want my doctor, my student to achieve these goals or to be able to perform these roles, he needs to do something which those artists are doing, be a method actor. In our training of undergraduates or in our training of MBBS course, this is what we are aiming at doing. We are trying to teach the students what are the various aspects of learning to play each one of these roles. Teaching our students in such a way that they really get under the skin of each one of these. All right, now some more brainstorming, some more reflection. Now, these are some of the attributes. Just think about on a scale of 1 to 10, where do your graduates stand? Clinical care. Where do your graduates stand in clinical care on a scale of 1 to 10? Okay, 6. All right. One more response if I can have. 7. Awesome. Even I agree with that. I agree. Our students are extremely good clinicians, or they turn out to be, at least at the end of post-graduation. Leadership skills. Leadership skills. How good a leader is my student? 5. Okay. Okay, Dr. Arvind, 6. Okay, you're overscoring them probably. Teamwork. Do I know how to work in a team? How would you grade a student, a graduate which you have passed out, an intern which has just gone out of your college, on a scale of 1 to 10? 5. Okay, 5. Awesome. Professionalism. This is something I think we all pride ourselves on. 4. Okay, okay. 5. Okay. 5. Lifelong learner. What do you say to lifelong learner? Pratibha, Dr. Pratibha, 4. All right, very good. We are trying to assess ourselves correctly. Communication skill. 6. Okay. Now my question changes. This is what you think is your student. Now a question for you and me. How was my teaching when it was related to clinical care? On a scale of 1 to 10, how good was my teaching when I was trying to teach clinical care? Okay, 6. 8. Yes, I would actually go high on this. 9. I wouldn't put 10, but I would actually go above 7. What about leadership skills? Where do you rate us in teaching? 7. 5. Yes, Dr. Ajit, I would agree. Binu, very true. Dr. Binu, yes. Dr. Priyanka, 5. Actually, I would go with Binu, who mentioned 2 or 3. Okay. Okay. Teamwork. Do I teach my graduate anything about teamwork? Do I teach my graduate anything about teamwork? 6, 3, 5. All right. Professionalism. 4, 3. Lifelong learner. Do I teach my student you need to be a lifelong learner? 4, 3. Very good. Communication skills. This I think we'll grade more. Communication skills. 1. Okay. 5. Okay, fine. Now the last part, which I don't want you to grade, I just want you to ponder over. You know what you have given to your graduate when you're teaching them. You know what your graduate turned out to be. Just think, even if I'm teaching or I feel I'm teaching, am I actually assessing them? This is just for you to think. I don't want you to respond to this question. That's why I said we will recall and we will reflect. So today's session is all about making sure we have an alignment among what is the competency which I expect my IMG to be, what should I teach, how should I teach. Assessment we'll deal with later. Okay. Now, if I think of the traditional education system, which we have been talking about now, it was experts like you and me which decided what needs to be taught to the student. Based on subject experts, the content was derived. Based on the content, well, I need to teach the student surgery. Let's show them a video. We decided strategies. Often, based on the content, we also planned on assessment. But one thing which was uniform throughout, that thing was our assessment was always on what did the student learn, whether the student learned, yes, no. Does my student know this? Does he not know this? If he knows, how much does he know? So this is how we have been taught. This is how we have been teaching. CBME changes this. CBME says what you're planning to teach depends on health needs of the community. That is what is going to decide my TL methods. Those competencies are going to decide my assessment. So we are not going to test only do I know, do I not know. Yes, I need to test that. I need to test how much or what does a student know. But now comes the difficult part. We need to test what did the student learn. We need to test when did the student learn. And this is where our objectives come into play. So outcome-based approach to designing, implementation, assessment and evaluation of program using competency. So I will just stick to the first part today, designing. So when I'm designing my CBME curriculum, I start with the base in mind. I start with the goal in mind. And for that, I need to go back down to my classes. So I need to identify what are the learning outcomes. And always we need to remember that our educational outcome are the deciding force here. It is not, what I'm asking in exam, but what is important is what should my student be knowing. So this particular book, which has become like a Bible or a Gita for us, it's telling us so many things. The various sections are what are talking about what we are doing today. So it talks about this Indian medical graduate. It talks about the goals, which are 5 in number. That's what the country expects from the graduate. It talks about the various institutional goals, which are 11 in number, which talk about what each of these institutions, our colleges, are planning to ensure our students learn. And now comes the goals for the learner. These goals for the learner are 5 in number, or they are the roles which I just described. So each Indian medical graduate, in order to fulfill those roles, is going to try to achieve these. These are the goals. Now, the confusing word competency being used with another term, subcompetency. But what are they? They are basically subject-related competency, more than 2,900 in number. And now comes the part which we all need to do, that's defining the SLOs from them. The SLOs are going to be much more than what these competencies are. So the goals, that's the national, institutional, and goals for learners are aspirational statements. They are what we aspire our graduate to be. Whereas the competencies and SLOs are the learner outcomes. These are what is going to be actually prepared by us and actually going to help us assess a student. So what's the importance of goal? The same importance whatever goal has in life, in CBME, the goal will help us choose the curricular content. So the national goal has helped NMC decide what is the curriculum. Assign priorities. The same NMC or now the institutions are going to assign priorities based on what are our local goals or the institutional goals. What importance does a goal have for a teacher like you and me? Well, a teacher like you and me is going to decide our teaching learning methods and assessment based on the goals. Besides that, goals also help me in evaluating this curriculum and communicating to others. What does that mean? Well, that simply means I need to tell my policyholder, I need to tell the parent, I need to tell the parliament, because they are the ones who are going to decide final course of the outcomes. So we need to communicate to them that this is what an Indian medical graduate is going to be. All right, so now we move on. Now these are in the volume 3, the more than 2,000 subject competencies what we talked about. In the volume 3, with the surgical and allied branches, there are 9 topics in ophthalmology, with 60 outcomes. And in otolaryngology, which I'll be calling ENT henceforth, there are 4 topics and 76 outcomes. So first thing to remember, the topics and the outcomes need not match always. As you can see, the outcomes are different. Even if you look at the teaching hours, ophthalmology has 100 teaching hours, ENT has 70. In spite of that, the number of outcome expected are not proportionate to that. So we must remember, when these topics and outcomes were designed, it did not exactly match it to the number of hours which we are teaching. Okay, now one very important part before we go on designing SLOs. What do we mean by core and non-core? It's very important for us to understand. In the last session, Dr. Unnikrishnan had shown the table of competencies. Now, in that table, there is something called core, which if it's a core outcome, it's marked as Y, yes. A non-core is not marked as yes. So what we mean by that, always my teaching, the teaching learning methods, the SLO, 80% would be the core topic. And the core topic would be included in both formative and summative assessment. Whereas the non-core topic may not be included in the summative assessment. Also, very important for us to remember that we should never exceed non-core topics more than 20%. It's important when we start defining our hours, which we will be doing subsequently. Because the timetables have not been given, SLOs have not been given. So this particular concept of 80% and 20% becomes important there. All right, now we move on to something which is known as proficiency level. Last time it was decided that when we are talking about competency, it's a ladder. We move on along the ladder from down to up. We keep on increasing our proficiency. So these are again the keywords which are very important for us to remember when we are making our SLOs. The booklet gives very clearly, or it at least guides us as to what is the level of proficiency expected from the Indian medical graduate. So if it says knows, it's just talking about the knowledge. I just want a student to know a particular thing. Knows how, a little higher level. At that point, the student should be able to discuss or analyze a situation. Shows and shows how refer to the skills. Okay, psychomotor domain. So just demonstrate something is shows, and be able to interpret or demonstrate a procedure using your thought, knowledge, and behavior is shows how. Why is it important? Well, because when we are writing the SLOs, we need to pick out our works based on what is the proficiency level we are talking about. Performs, that's the mastery level. Now, performance for ENT and ophthalmology, we do not expect our students, we do not have too many skills where we are actually expecting them to perform. We have a handful of skills or handful of competencies which we'll actually ask them to demonstrate and perform independently. Of course, there are some which are required to be performed under supervision. Please remember, many times we question ourselves or we question the NMC in the book. How can they call it just a shows how? How can they expect this to be only knows? The student must know this. But then that's the postgraduate specialist in you talking. What the NMC wants is the physician of first contact. So that is why these proficiency levels are going to be guiding us in preparing the SLOs. Of course, based on our local needs, based on the changing needs or the changing health scenarios, we can always modify and go up, increase our proficiency levels. Okay, so I've just taken one small table from ophthalmology. So as this was already discussed, these are the competency. Now, when the first competency says, describe the physiology of vision, it's just a knowledge. Here, the level is in the domain, it's a knowledge domain. The fourth column talks about the level. So it's a knows how level. Is it a core competency? Yes, it's a core competency. They have given the suggested teaching learning method. I will not go on to rest of the table. So when they say describe physiology of vision, my ophthal friends here will agree, physiology, it looks like a question, right? It just looks like one of the long questions, describe physiology of vision. It can be a long question. But to make this into SLO, one competency can be, maybe, needs to be broken up into multiple specific learning objectives. There is no rule to say one competency is equivalent to one SLO, or one competency is equal to 5 SLOs, or one SLO must be covered by one competency. It is possible that you design a SLO which covers more than one competencies. So the number of competency and number of SLOs are not interchangeable. We need to look at each thing independently when we are designing a SLO. So another thing from ENT, describe the anatomy and physiology of ear, nose, throat, head and neck. Now I'm sure my ENT friends agree. This is a big various parts which I'm sure you will not be covering in one lecture. So we must remember, take home message from this particular table, one competency is not equal to one SLO. The number needs to be defined by you, the subject experts. Now, one more point. What is the difference between a competency and an objective? A competency is an aspirational statement, which is what observable ability of a health professional. It integrates multiple components. A competency, in the previous table, when I'm talking of the domain, please remember, these are the primary domains. It does not mean that when a domain is knowledge, it cannot include a skill component. So if there is a skill component, it will include the knowledge. If I'm performing something, automatically attitudes will come. So competency is an integration of all of these things. If we compare this to objectives are statements of what a learner should be able to do at the end of a specific learning experience. This experience may be a 1-hour session. It may be a 3-hour clinical class. It may also be a 5-hour module. So objectives can be of, the learning experience can be of various duration. Objectives are always narrow. They are precise and they are derived from this competency. And of course, they are going to be measurable, but in terms of learner, what my learner did, not what I did at end of the class. And like I already emphasized, multiple objects be derived from a single competency. So now, before I end my presentation, just I move on to the term educational objective. And this is a funnel, or this is a circle which we are all familiar with. Our basic course workshop, our revised basic course workshop have all spoken about this. I prefer the circle diagram more than the pyramid one, because each one in the circle is depicting to be a part of it. So the whatever is my lesson outcome is going to be a part of my unit or a course outcome, which is going to be a part of my program outcome, which is again going to be a part of my institutional outcome or a part of my national outcome. So this is how they proceed, and each one, okay, let's go to this statement. At the end of MBBS course, the graduate will be able to provide preventive and curative care to individuals and community in health and in disease. What type of objective do you feel it is? I can have some responses on the chat box. What type of objective do you feel it is? Institutional, departmental, teachers? What type of objective? Or national? Any responses? At end of the MBBS course, the graduate will be able to national. Okay, fine. So these are either national. Okay, all right. I'm sorry, my slide is okay. Am I audible?
Yes.
Okay, sorry. All right. So that can be a national objective. It can also be an institutional objective. Now, let's listen to the next one. At end of MBBS Part 1, the student, sorry, that's an error. At end of MBBS Part 2, final MBBS Part 1, or the student will be able to apply the knowledge of ophthalmology towards managing common ocular health problems of a society. What sort of objective is this? Is this the objective of your institution, objective of a department, objective of a teacher in the department? What type of objective do you feel this is? Departmental? Yes, very true. One more. At the end of, correct, departmental, at the end of MBBS part, final MBBS part 1, the student will be able to apply the knowledge of otolaryngology towards managing common ocular health problems of society. What objective is this? What sort of objective is this? Yes, correct. It's also a departmental objective. So both of these are departmental objective, which are coming under the broader institutional objectives. So far, what we have done is, I go back to my objectives. We recalled and familiarized the terms used in CBME module while we need to write the SLOs. We explained the relationship between goals, roles, competency, and objective. We differentiated competency from objective. So now I will hand over to Dr. Vijayalakshmi to carry on to what are the various attributes of a SLO and how are we going to prepare a SLO from these competencies. Yes, Vijay, your screen is visible. Okay, all right, over to you, Vijayalakshmi.
Just a minute, I'll share my screen again. Somehow I couldn't unmute myself, so I'll do that again.
You are unmuted now. You can just yeah.
So is my screen seen now?
Yes, your screen is
okay.
It's
okay. So good evening, everyone, and thank you so much, Rashmi, for that introduction and the detailed description of the distinguishing features between a competency and a specific learning objective. And that actually makes the continuation of the session easy for me. So this session, we'll be focusing on writing SLOs and aligning the teaching learning method to the specific learning objectives. So the objectives of this session will be, at the end of this session, I would expect the participants who are listening to me to define an SLO, to list the qualities of an SLO, list and identify the elements of a specific learning objective, and write SLOs based on the guidelines given. So let's go into what is a learning objective. A learning objective is actually a statement of the measurable learning that is intended to take place as a result of instruction. So I think the key word here, it is measurable learning and as a result of instruction. So these are the two keywords over here. Now why do we need learning objectives? So when we plan our course through objectives, the learning objectives facilitate course development. The students get to know what the expectations of each course are. So in other words, learning objectives are nothing but expectations spelled out explicitly for the students. Further, they guide the development of all the instructional activities. So based on the objectives, we plan our instructional methods, what we call as the teaching learning methods. And again, The objectives direct the development of the assessment methods and the evaluation methods. A good learning objective is one that can be assessed to determine the student's mastery of the course material. So whenever we write a learning objective, we should look at if we can assess the student based on the objective we have written. So it's not just the instructional method that needs to be aligned to the objective. It is also the assessment method that has to be aligned to the learning objective. So the learning objective does not focus on the process of instruction, but it focuses on the intended result of instruction, what we want our student to learn at the end of the teaching learning session is what a learning objective should describe. Now, all of you are familiar with this. Learning objectives need to be SMART, that is specific, measurable, achievable, realistic, and time bound. So I will not go into the details of this because all of you are familiar with this. So what are the qualities of a specific learning objective? I already said a learning objective should be SMART, specific, measurable, achievable, realistic, and time bound. It should also be relevant. It should be unequivocal. So it should not have any ambiguity. It should be feasible and it should be observable. So whenever we write a learning objective, we should begin with the end in mind. So here I'm just listing out some guidelines for writing objectives. So whenever we write learning objectives, we need to use action verbs to specify student behavior. Our statements should be kept short and focused on a single outcome. The learning objective, when we write the learning objective, we should explain the expectations for student behavior, performance, and understanding. We should use specific terminology. And the terminology, we already said, it should be unequivocal. So it should have limited interpretation. There should be no ambiguity. And it should ensure that all the students understand the same interpretation. The specific learning objectives should be written in this manner. First, it should state what the student will be able to do. Or in other words, it is the observable behavior or the action, with the conditions under which they should be able to demonstrate. So that is the condition. And the expected degree of proficiency or the criteria. So specific learning objectives, when we write, we should specify three things. One is the observable behavior or the action, then the condition, and then the criteria. So in the beginning, I gave a specific learning objective for this session, saying that at the end of this session, participants will be able to write SLOs using the guidelines given. So I want somebody to answer, what is the observable behavior that is expected? Rashmi, I cannot, somehow I'm unable to see the chat box. Can you see that if they're
Yes,
writing?
I will reply. I'm seeing the chat box. I'll reply whenever anybody else. Yeah, so what's the observable behavior? If we can have a response.
I have highlighted it.
Yeah, able to write SLO. Right, Dr. Belu, correct. Dr.
That is
Ajit, right, correct. Right, yes, most of them have answered as right SLO, which is correct.
So what is the condition here?
using the guidelines. Okay.
The condition is
End of
at
the
the
session.
end of this session.
Yes, guidelines. Correct. So when, correct.
So what is the criterion? What is the criterion?
Using what? Yes, yes. All have responded using guidelines. Very true, very correct.
So I think that has clear now. You need to specify the behavior or the act, and then the condition and the criterion when you write a specific learning objective. So in other words, a specific learning objective is a statement of who should do how much or how well of what under what circumstances, right? A statement of who should do how much or how well of what under what circumstances. Now, just a recap of the various domains of learning objectives. All of you know that there are three domains: the cognitive, affective, and the psychomotor objectives. The cognitive objectives describe the knowledge that learners are to acquire. Affective objectives describe the attitudes, feelings, and dispositions that learners are expected to develop, while psychomotor objectives relate to the manipulative and motor skills that learners are to master. So here again, I'm giving the guidelines for writing objectives. So we need to use action verbs to specify student behavior. Statements should be short and focused on a single outcome. We need to explain the expectations for student behavior, performance, and understanding, and use specific terminology that has limited interpretation so that all students understand the same interpretation. Now, let us take a couple of competencies and look at the SLOs. So this is an ENT related competency number 2.4 in the MCI booklet. Demonstrate the correct technique of performance and interpret tuning fork tests. So for this, I have written a few SLOs. At the end of the teaching session, the third year MBBS Part 1 student should be able to describe the different parts of the tuning fork correctly, describe different types and frequencies of tuning fork correctly, demonstrate the correct method of holding and striking of the tuning fork, demonstrate correctly Rene-Weber test and absolute bone conduction test, interpret tuning fork test findings in conductive, mixed, and sensory neural hearing loss correctly. So this is again another competency. Demonstrate the correct technique of examination of neck, including elicitation of laryngeal crepitus. At the end of the teaching session, the third year MBBS Part 1 student should be able to enumerate the various triangles of neck correctly and explain their boundaries, outline the levels of lymph nodes in the neck as per the Memorial Sloan Kettering Cancer Center classification, demonstrate the correct method of palpation of various lymph nodes in the neck, elicit laryngeal crepitus correctly. Now here we are going on to an ophthalmology competency. Counsel patients and family about eye donation in a simulated environment. So at the end of the clinical class, the final year MBBS Part 1 student should be able to highlight the significance of eye donation in dealing with corneal blindness, discuss keratoplasty surgery in a language understood by non-medical person, list the various indications for keratoplasty. Then you discuss keratoplasty in a language understood by a non-medical person, outline the steps of collection of donor eye, list the procedure to be followed after death for cornea retrieval, demonstrate empathy and listening skills while counseling in a standardized patient.
So, Dr. Lakshmi, yeah, we'll just pause here for a minute.
Yeah.
So, if you can just see from both the examples which have been used. Okay, if we go to, I'll just talk about the ophthal example to start with. The SLOs which we have made are not complete SLOs, are not completely covering the topic or the competency mentioned. Okay, this is just an example of how the SLOs for these can be. So the SLO which we have prepared, for example, when we are talking of eye donation, this may or may not be completed in one class. This is a topic which may be covered. And if you see, we are changing the level of all of these. They are talking about the knowledge domain. So when you go to a skill such as counseling, if I expect my student to counsel, listing, discussing keratoplasty, outlining the steps of collection of donor eye, all of these are something which are the basic knowledge he must possess, because this is what he is going to talk about. So if this was going to be just 1 hour session, the SLO here would probably be only demonstrate empathy and listening skills while counseling in a standardized patient. This particular thing can change. If I would like to assess my student, or if I would like to teach my student only the knowledge, if I would just like him to talk about convincing a patient. So our SLOs are not very static. They are a little dynamic based on what is it that we would like to teach. So yeah, next slide, Vijay. Now you can take over again to the teaching learning. Yeah.
So now we've been repeatedly saying that we need to derive SLOs out of the competencies that have been specified. And then we need to plan our instructional strategies based on the learning objectives for each session. And as Rashmi just said, the SLOs are quite dynamic. You know, it depends upon what exactly we want a student to do, to be able to do. And again, we also said it has to go in a step ladder pattern. So it's based upon the milestones we want the student to achieve at each level, at the end of 1 week posting, at the end of 2 week posting, at the end of 2 days of class. So based on that, we will plan our specific learning objectives, and then we plan our instructional strategies to link to the SLO. So the instructional strategies have to be aligned to the learning objectives. So here I'm just listing some of the commonly used instructional methods: lectures, tutorials, seminars, concept maps, symposiums, demonstrations, which could be a live demonstration or it could be a video assisted demonstration, bedside clinics, simulations, role plays. So this is just a list. The list can, you can add more and more to this list. Now, usually when we want to do mass instruction, a large group teaching, we use conventional lectures where we can do video presentations, and we also give more mass practical work. When we want individualized learning, we give them open learning materials, and then we give them some kind of learning materials where they can do self-directed learning. Also, though problem-based learning, many of us have just started to do, and we are not, because problem-based learning requires uh, hybrid curriculum. Problem-based learning also promotes individualized learning. And then we have the group learning methods like group discussions, seminars, group tutorials, and you can have the group games and simulations, also group projects, and again problem-based learning. So I think I will skip this slide because these are the same thing: mass instruction, individualized learning, and group learning discussed with the role of the teacher and the role of students. So when you look at the traditional lectures, the teacher is in the control of all aspects of the instruction process, and the students are largely passive, right? Whereas when we use the individualized teaching learning strategies, the students are responsible for their own learning, and they are in a position to control the pace of learning and their depth of study. Now, when we have group learning, though the students are responsible for their learning here, they are also dependent on another's preparation and interaction, not just the teacher, but also the peers, right? And the teacher has a supportive role in group learning. Now let us go back to the competencies which we just discussed, and I shared some of the SLOs. And I would request you all to tell us what kind of teaching learning method you will use for each of these SLOs that have been written. Yes, before we go there, uh, this is just to summarize. Based on the intended outcome or competency, we write the learning objectives, and then we plan the learning methods, and we also link the assessment methods to the learning objectives and the instructional strategies that we have used. So the overall learning experience that our student goes through depends upon the learning objectives, the learning methods, and the assessment methods. And all these three in turn uh, are responsible for uh, ensuring the competency or the intended outcome of learning. So let's now go on to the competency based on which I had just shared specific learning objectives. So I would request you to please let me know what teaching learning method you would like to adopt for each of these SLOs. So at the end of the teaching session, the third year MBBS Part 1 student should be able to describe the different parts of the tuning fork correctly. So what instructional strategy will you use? You can unmute yourself also and speak, or you can write on the chat box.
Yeah, we have responses on the chat box. It can be demonstration in OPD. Okay. Small group teaching, fine. Small group discussions, okay. Video clippings, okay, Dr. Pratibha, that's the interesting way, right? Video clippings can be used.
So can we do this in the large group as well? Most of you have shared small group discussion, demonstration. Can we do it on the large group? Yes, somebody says yes, it can be done in the large group as well. So let's go to the next objective. Yeah, describe the different types and frequencies of the tuning fork correctly.
Demonstration, okay. Lecture, yes, yes. Lecture, okay. Large group, yes, very true. In fact, both
Yes.
of them, different parts as well as types and frequencies can very well be taught in large group tutorials, small group tutorials, okay. Lecture. Okay, so the next objective.
So these two objectives are what type of objectives? We just categorized objectives into different types. So these two objectives are essentially what type of objectives?
Knowledge domain, knows, yes, okay. The domains are knowledge, correct.
So now let's go to the next one. Demonstrate the correct method of holding and striking of the tuning fork. And next, demonstrate correctly the Rene's, Weber, and the absolute bone conduction test. So what are these two objectives, and what instructional strategy will you use to teach your students these things?
Okay, so these are small group discussions, clinical skills, shows and shows how. Yes, these are the domains, very true. And how would we teach them would be clinical demonstrations in small groups, all right? As such, I think, yeah, small groups, correct, correct. Okay, so most have opted for small group teachings on clinical demonstrations.
Okay. Interpret tuning fork test findings in conductive, mixed, and sensory neural hearing loss correctly. So what type of objective is this, and what teaching learning method will you use for teaching this? Are we getting any answers?
Yes, it's higher level, large group knows how, shows how. Okay, so yeah, shows how.
It is interpreting the tuning fork test. So it is,
Is it
yes, you are.
knowledge or is it skill? It's skill, okay. It's a clinical demonstration, okay. Interpretation is a skill, definitely. Just like how clinical reasoning is a skill, practical demo, yes, skill.
Can we do this interpretation of tuning fork test? Can we do this during an online session like this? Can we use charts to uh, teach them the interpretation? Can I put a table of different types of hearing loss, conductive, what happens to the various tuning fork tests, and then ask the student, uh, teach the student what happens to the tuning Rene in conductive loss, what happens to the Weber in conductive loss. Similarly, in mixed and sensory neural hearing loss, can I put tables, that is the charts, and then teach them? It can be done online.
Yes, lots of yes, agree. I think after pandemic, I think most of us will choose or be happy with the online options also. Okay,
Right.
no no's, it's all yes. All right.
Yes. So that is about this session. Now we go to the next competency that we had taken up.
Actually, okay,
At
we
the
have
end
a
of the teaching session.
yeah, one second, Dr. Vijay. Actually, interpret need not be show how. It's more of know how. It's application of knowledge. Very true, Dr.
Exactly.
Yes.
Exactly. It is a high order thinking skill,
Yes.
and it is actually based on their reasoning and analysis. So it is a skill, but it is in the knowledge domain.
Knowledge domain. Very true. Very true.
So,
Okay.
so
Next
here,
example.
the enumerate the various triangles of the neck correctly and explain their boundaries. So which type of objective and what teaching learning strategy will you use?
Lecture knowledge.
Right. Outline the levels of lymph nodes in the neck as per the memorial
Knowledge knows how, knows, okay. Lecture, SGP knows, lecture.
Rashmi, I see a raised hand. I think somebody is asking for something.
Okay, I have
Dr. Nandini, if you have a
yeah,
question?
you can all unmute actually. I Dr. Nandita, I can see. Okay, raised by mistake. No problem, Dr. Nandita. Okay, continue, Dr. Vijay.
Okay.
Yeah.
Demonstrate the correct method of palpation of various lymph nodes in the neck. So what type of objective is this, and how will you teach?
Small group, psychomotor, skill, shows how.
Right?
SGD, demo, clinicals, okay. Shows how. Skill, small group. Demo. Video demo, yes. Very true, Dr. Meenu. Video demo, yes. Okay.
So when you want the student to be able to perform a lymph node examination or palpate lymph nodes in the neck, we have what is called as DOAP. In that, assistance may not be required for palpating the neck, but we can do the demonstrate, observe, and then perform. The DOP session can be taken up for this, and as you all rightly pointed out, this can be done this is best done in the small group teaching methods. Elicit laryngeal crepitus correctly. So do you agree with me that the same method which we all suggested for palpation of lymph nodes can be used for teaching how to elicit laryngeal crepitus as well?
Shows how, demo, yes.
Yes.
Skill, correct, yes. Or shows, correct.
So,
Okay.
Thank you very much for interacting and responding so quickly. And Rashmi, thank you so much for coordinating that part. To sum up, we need to remember that every role that our graduate plays is made up of different competencies. Each competency can be achieved by a set of specific learning objectives. SLOs should be smart, and there should be alignment between the competency, objectives, the teaching learning methods, and assessment. So with that, we come to the end of today's session. If you have any queries, we will be able to answer them. You can share your questions in the chat box or even unmute yourself and ask your questions. I will just stop sharing the screen so that I can see the chat box and I can respond to you as well.
In today's session, we have just given a very brief outline or what is it that we need to follow. In subsequent sessions, we will be talking about how to exactly make the SLOs. As how the plan has been going on in other branches, the entire batch would be divided into 2 or 3 groups, and each group would be required to actually prepare the SLOs, and we'll have a presentation and a discussion. So yes, Dr. Unnikrishnan, thank you for appreciating, and today's talk will set the ball rolling. Very true, very true.
Yeah, we tried to keep it as simple as possible because the future sessions need to actually will build up over this session, and we request all of you to look at the MCI booklet, the various competencies that have been specified for both our specialties, and at least start thinking how we are going to write SLOs, how we are going to plan our instructional strategies for a couple of competencies before we meet up again in the next sessions. So, are there any questions from any of the participants?
No, Dr. Vijay, I don't think I see any other questions. Thank you. Yeah. Thank you, everyone. Yeah.
So, if there are no further questions, then I think we'll wind up for the day. Is that okay?
Yeah.
Dr. Unnikrishnan, Dr. Sanjay Bedi is around?
Dr. is not there. Yeah, we are all here.
Okay.
Okay.
Fine. So, thank you very much for joining us today, and we look forward to more interactive sessions in the weeks to come. Dr. Unnikrishnan is muted. Okay,
You're muted. Oh, I'll just see where are you, sir? Actually, all the participants are allowed to unmute. I can't see.
Hello.
Yes.
Yeah. Finally, when ladies speak, men have to keep quiet. No?
All the men are well trained at home, you know.
I've been trying to say this is fantastic. Yeah. So the example is also very nice. So I hope. So what is the plan? Do we have people left? Do we start? Have we given homework?
No. What?
Kuch maza nahi teaching without giving homework.
Yeah, actually, our next session by Dr. Anuja is going to be on teaching skills. So
Okay. So you're not okay. Fine.
yeah, so I think what we can do is, because it's New Year also, and so probably we will hold on our assignments till when. Okay, we have a question just before that. When we
Yeah,
write
Binu, that's-
SLOs, is it required to mention the number of patients on whom the test is to be demonstrated? Dr. Vijay, you want to take the question?
I did not get.
Okay, I'll repeat
his-
again. When we write
No,
the
no, no.
SLO,
I am not. I'm seeing the chat box, but I'm not clear on that question.
okay, I will answer
Do you
that
mean?
then.
Do you mean suppose you want the student to perform Rene's test? How many patients the student should perform Rene's test?
Yeah, Dr. Vijayalakshmi, I'll take that. Binu.
Yeah, sure. Yes,
Yeah.
yes.
So, actually, this would depend on the specific skill involved. So, if you're specifically talking of Rene's test, then I don't really think number of patients becomes that much of a thing. Probably that would be for higher skills. Probably that could be a necessity. But for this, I think demonstrating on peers, demonstrating on each other, demonstrating similar patients, that should be enough. And to actually take it to the next level, all this would become a part of the logbook portfolio. Maybe at the logbook, you could specify that at the end of the posting of 7 weeks in ENT, that students should have demonstrated 10 correctly done tuning forks, something like that.
Correct.
On patients.
And
But on a given SLO, I don't really think, at least for tuning fork, I don't think the number of patients is important.
yeah, Dr. Nandita has rightly pointed out the number of patients would be the certification criteria.
Yeah,
And
logbook portfolio, those
and
things.
eventually
Yes.
we want the student to also interpret. So as I said, if you give charts or something, and then based on the charts, the student is able to interpret, that also can be certified, saying that the student can interpret this many mild conductive hearing loss, this many moderate conductive hearing loss is done, this many sensory neural hearing loss. So we can certify that.
Yeah, there is one more aspect. Now, when we are talking about SLO, so when we are going to go on to the teaching of clinical skill, we do mention that a particular skill should be performed at least in 5 patients. For example, in ophthalmology, in the logbook, when I ask them to make entries for skills such as vision testing and all, I do specify the numbers.
Yeah, but that is in logbook, no?
Yes, in the logbook. So like the
In an
question
SLO,
was,
it did not
when
come.
we
Yeah.
write the, yes, so it depends now. If you're writing a broader objective,
Yeah,
not of
true,
a
true,
session,
true.
then you can write it.
Yeah,
But
true,
if you're
true.
talking about the session, then you can say that, you should do it. But it's very good if we mention minimum number required. And of course, when we discuss logbook, that number will again hold true or be important.
Yeah.
So there is another thing. If the student practices in a simulated setting, you
Yeah,
give a
that's right.
standardized patient. It
Yes.
is more than the number of patients. The number of times the student practices and gives the same interpretation also can be certified.
Yes.
Yeah,
Yes.
because actually going ahead in our practice and all, number of patients can be an issue.
Yes, very
All
true.
this
Yeah, yeah.
medical legal
With-
and all,
with-
it's always
yeah.
on the edge, except for the very government medical college. Apart from those, all these things can be a big issue. So number of patients, something that we should not stress on too much, I feel.
Very true. Probably when we discuss the logbook, this will be even clarified a little more. But yeah, that's as of now, Dr. Binu. Correct.
We are definitely going to have, as Dr. Unnikrishnan said, these issues, especially more so with our postgraduate training. Luckily, our departments, the undergraduate training will still not suffer much. That's what I'm hoping.
Yeah.
Okay, so as we wind up, then our subsequent plan would be after next session by Dr. Anuja on clinical skills, how we are going to be teaching and training the students in that. Then we start with the assignment part and we move on to having presentations and subsequent things. So if that is okay with everyone.
Yes.
Okay.
So thank you very much, everyone. And wishing everyone a Merry Christmas. And I think we'll be meeting before New Year.
Yes.
Yeah.
Dr. Ajit wanted to say something. He has raised his hands.
Okay.
Yes, Dr. Ajit, I think he's also muted. So I'll unmute him. 1 minute.
Yeah, he's unmuted.
Yeah.
Yes, good evening everyone. Rashmi madam and Vijayalakshmi madam, it was a very wonderful session. So I just wanted to add one thing. And one of the participants asked regarding the certification criteria. So as far as the ENT curriculum is concerned, I think there is no competency which needs to be certified. So as such, the curriculum does not say the minimum number of procedures a student should perform to get it certified. But again, yes, as Rashmi madam said, that if we are thinking that it is a core competency, then definitely we can set some number of times a student should perform a particular procedure depending upon its clinical importance. But as such, yes, but as such in our ENT curriculum, there is no competency which needs to be certified.
I agree with you, Dr. Ajit, but I think the MCI document is not complete when it comes to the competencies in ENT. There are some errors also in it, which if I have
one whole page is there's a spelling mistake.
So
Yes,
I
ma'am.
think it should be us who are actually planning. Who we should spell out what we expect of our student, and we need to work on that, because as usual the MCI gives only the minimum criteria. I think we need to work on
Only the
raising the bar.
skeleton is given. Now you have to put on all the
may I
flesh.
add something, please, ma'am?
Yeah,
Good evening,
I think
everybody.
Yeah.
Yes, ma'am. Good evening. First of all, thank you, Rashmi ma'am, and thank you, Vijaya ma'am. It was such a wonderful session, and it took us all so briefly and so into the depth, actually, both paradoxically. It was a wonderful revision and a wonderful amalgam of ophthalmology and ENT together. Thank you, ma'am. And I would just like to add to something that Dr. Ajit said. We do not have competencies, definitely, which says certifiable skills. But if you look at the number of skills which the graduate has to do at the end, that is at the time of internship, we will be interested to know there are about 5 or 6 competencies in ophthalmology and 3 in ENT, which includes anterior nasal packing and otoscopy. So they are certifiable skills there. They may not be in the subject, but per se for the graduate, they are there. And also one thing I would like to add, that as Rashmi ma'am was saying, I think ma'am, the next session we would be doing on integration and SDL. And then I think we have the ball more rolling faster. And then we would be going on to skills. Thank you, ma'am. Thank you so much. Thank you, everybody.
All right.
Thank you very much.
Dr. Sanjay, would you like to just say something, or can we wind up?
We can wind up.
Oh,